Obadde okimanyi tugenda kujja mami yakugambye no tugenda kujja.
We meet 35-year-old Dorothy seated forlornly by herself. From our first conversation, she has no clue who I am, despite the phone calls I had had with her mother about my visit.
I am really forgetful. Even going to Mulago Hospital, my mother texts me.
Her mother, 77-year-old Oliver Janet Nabanja, had warned me prior to my visit at their home in Gombe that she is forgetful. As Dorothy continues regaling me with her life story, Oliver appears and throws more light about Dorothy's predicament.
You see, my daughter is in this state, but she was a hard-working woman with her own shop. The father to her last born infected her with HIV.
As her health deteriorated, her mom decided to rescue her daughter from a relationship where the partner was not caring.
It is a miracle she's faring well. She was worse, but we never defaulted in going to the IDI in Mulago.
As they treated her for HIV, she started having episodes of seizure, dizziness, and started portraying signs of forgetfulness.
She used to take her meds solely, but right now I have to remember for her.
Dorothy's mental ability has been declining gradually over time, and this has affected her daily life. Forgetfulness has become part of it. In fact, since I came here, she has been telling me the same stories all over again. Even my name, it's hard to remember. Dorothy, do you still remember my name? Angela. Florence.
Dorothy is receiving treatment at the Infectious Disease Institute IDI at Mulago Hospital. Dr. Noelin Nakasuja, the acting chairperson, Department of Psychiatry, School of Medicine at Makerere University, expounds more on this behavior.
We call it perseveration. A person will keep telling you the same story, even when they have said it before. So they forget they have told you, so they repeat what they have said before. Very typical.
During review, Dr. Noelin starts examining her cognitive ability through a simple test, including her age, where she came from today, and how she got to IDI. She gives her an exercise to test her memory.
So what I was trying to demonstrate for you was the issue of the acquiring of knowledge. You know, we're having this conversation, I say something, you internalize it, interpret it. The difficulties you saw was in her trying to interpret what I have said. So I tell you do this, but you saw what she did. You saw me asking her if she's ever seen me. Today I'm lucky she said yes.
Dorothy can hardly remember anything. She's suffering from HIV dementia.
It can happen with anyone who has HIV. Okay? So what the virus does is that when one gets infected with HIV, the virus moves very quickly to the brain. And even when sometimes people might be started on antiretroviral therapy, they still will have the, HIV dementia because many of the drugs that we have do not enter very well into the brain to mop out the virus within the brain.
World Health Organization defines dementia as a syndrome in which there is deterioration in memory, thinking, behavior, and the ability to perform everyday activities. It is prevalent in 47.5 million people globally and afflicts 7.7 million people per year. Though known to occur in people older than 60, it has other causes which manifest in the younger population, according to Professor Musisi Segani.
Amongst the most common infections that go to the brain in this country is HIV/AIDS. There are also others like syphilis, meningitis, or bacterial meningitis from other causes. Even tuberculosis goes to the brain.
HIV is the worst of the viruses to affect the brain.
Even for a child before they are born, some die even before they are born. Some are born with very small brains and they never develop to normal intellect.
Before ARVs were introduced, a research done at Mulago by the IDA team, including Professor Segane and Dr. Nakasuja, revealed that 30% of people without ARVs who are HIV positive will get dementia, and a much bigger fraction will get some brain damage.
With the ARVs started early, you can reduce it to about 10%, but you do not eradicate it.
In fact, HIV-associated neurocognitive damage or disorders are now the main challenge to HIV/AIDS treatment.
We say adherence to taking the drugs must be more than 95%. Very important to stop more viruses from going to the brain.
What's ideal, though, is life without HIV for those that are still negative. Dorothy is in the 3rd stage of HIV dementia, the severest. But the fact that she has been getting medication, degeneration of her mental faculties has been slow.
She can still do some chores, cook and wash the dishes.
The regimen she was on before, we've had to change it to one which maybe may have better penetration into her brain.
Which brings in mental health as key to the management of HIV/AIDS.
The caretakers too need counseling as the disease ravages their loved ones and dents their memory. Florence Nalimba, NTV.